4 people trying to get a GP appointment last month simply couldn't. That's the figure revealed by the ONS, who warn the delays are leaving many in crippling pain, destroying relationships and forcing some people to quit work.
Well, we've gone behind the scenes at a busy GP clinic in Birmingham to see what a typical day on the NHS Frontline is really like for doctors, nurses and the support staff.
Good morning, my Steve surgery.
Alice, is this painful?
Not really.
I mean, the good news is this looks like fasciitis and it's nothing to worry about.
I think this is hard of hearing.
There you go. Okay.
No, that's fine. What's her date of birth, please?
Hi, this is Dr. Raj. I have not been able to get through to you.
I see between 30 and 40 patients a day on average, but it depends. Other patients come in with complex needs and therefore that can change how our day goes really.
I started work at, 8:30? And guess what? I've already seen 18 patients. And the BMS suggests that we should not be seeing more than 25 patients a day.
So I've just finished the morning debrief, and in the next hour before afternoon surgery I'll get through about 100 blood results, lots of letters that I need to respond to, medication queries.
This morning has been really busy. There have been urgent telephone calls and face-to-faces. I'm just going to have to take this call now.
So I'm going to do a couple of prescriptions now. I still need to see a couple of more patients.
I'm a practice paramedic. I generally deal with all the acute appointments to take pressure off the GPs. I'll see around between 20 and 25 patients a day. I can go a week without seeing my children.
I've managed 32 patients, still going on, a bit tired.
He woke up this morning with...
Oh, bless him. Oh, let go, lovely. Is he drinking plenty?
Yeah, he's not really eating much.
I've managed 40 patients and I've stopped counting after that. I dealt with it as it came because that's part of the job. I'm home now, but not quite, because I've been asked to log on for a couple of hours and help out at the urgent treatment centre. My husband will have to put the kids to bed, but this isn't unusual.
Well, that explains a lot, doesn't it?
It's a busy day, isn't it? Joining us now from Birmingham is Dr. Anita Raja, who saw in that film. Firstly, Dr. Anita, thank you so much to you and your colleagues for letting us come behind the scenes of an average day in your surgery. I mean, my goodness me, as soon as you get there, it starts, doesn't it?
It really does. Thank you so much for inviting me on your show today, Ben and Susanna. It's always an honour. I mean, it's very important to see what actually happens behind closed doors, because unfortunately the way it's projected, it's always said that, you know, we're having long lunch breaks, we're probably taking a break, the GP surgery is shut for 2 hours in the afternoon. But this is very insightful. So it actually tells you how hard we're working. Even when the GP surgery is shut, we're still doing lots and lots of admin work, chasing bloods, doing prescriptions, calling patients, and the day simply doesn't end.
I can imagine there are a lot of people right now who know that they need to see a GP today and are sort of girding themselves for the inevitable, you know, your call is number 433 in a queue. We've seen the results of this survey, which show 1 in 4 don't get an appointment at all. 1 in 3 have trouble getting through to their GP. What is it like there? How many patients today at your GP surgery will not be able to see a GP at all?
So the thing is that the demand outstrips the supply, and we've never denied this being a general practitioner. your GP really wants to see you. And we've got to remember that GPs are members of public as well. So if I want to go and see my GP, I probably will be waiting on an average 7 days if I'm not number 1, 2, 3, or I don't know, number 40 in the queue first thing in the morning. And it can get very frustrating. But having said that, it's so vital to look at numbers and understand that it's not your GP's fault. They really, really want to see you and they want to facilitate you. Yet the government has failed to deliver its manifesto pledge. We are short 6,000 GPs full-time at the moment. If you look at GPs, the full-time number of GPs, we're around 2,000 GPs short since 2015. The number of registered patients, however, have gone up by 16%. We're delivering 1.3 million appointments a day, and we still are unable to meet demands. And if you were to ask me why this is happening, then there is over-medicalization of normal life. There is lack of access to secondary care, to mental health. There's lack of access to social care. And of course, the public is being let down. I think we need a bit more than just empty promises. Let's not focus on making maths mandatory, increasing hospital beds by thousands, and the numbers of ambulances. Let's sit down with the workforce and ask them what they really want.
Yeah. I wonder if you were reassured by something that the Prime Minister said in the House of Commons yesterday. You've already talked about, demand is outstripping supply. One MP asked about when new housing, for instance, is built, should the local health board then increase the number of GPs in that area? And he made quite a claim about the numbers of GPs at the moment. Let's have a listen.
The government is committed to increasing the number of doctors in general practice, and last year saw the highest ever number of doctors accept a GP training place.
The highest ever number of doctors accepting a GP training place. Well, that must have been music to your ears as a GP.
It certainly... It certainly is music to my ears, but I'm sorry I'm laughing on this, Susanna. I think that our Prime Minister has absolutely no idea how long it takes to train up a GP. And yes, we are recruiting people, but are we retaining them? We are a bucket full of holes. You can fill this bucket as much as you like. If you don't clog up these holes, you are going to suffer from brain drain, which certainly is the plight of the United Kingdom at the moment. GPs are highly qualified. Yeah.
Sorry, Dr. Anita, I was going to say, just explain to us then how long it will take, because it sounds exciting when he says more GPs have taken these training places than we've ever had. What is the time frame to get somebody from taking that training position to actually being a fully fledged GP?
It could be anything between 5 to 7 years. If a woman, for instance, like myself, got into GP training and is planning to have children, then please count in maternity leave as well. This is an unrealistic goal. And having said that, at the moment, if you look at GP training positions, yes, people are taking it up because it's far more flexible. It's a very family-friendly compared to other hospital specialties. But are we retaining these people? I don't think so. GPs are very likely to train here in the United Kingdom and then perhaps move to better opportunities. And these opportunities are not just for money. Money is not the problem here. The problem here is the working environment.
Right. And as we've seen from our report, behind the scenes at your GP practice, you are under so much pressure. I wonder if I can ask, how many patients do you see who you think you didn't need to come to the GP at all? And that's either because they've got a condition they could have managed themselves, or because they couldn't get into A&E, for instance, and therefore, or they couldn't get a hospital appointment, and therefore they're coming to the GP practice with something that has then got worse. Because, of course, you're blamed, aren't you, for sending people to A&E because they can't get a GP appointment. How many people do you think are unnecessarily turning up at your door?
I mean, it's a harsh, statement to make, but the matter of the fact is that 20 to 30% of these patients would have benefited from seeing a pharmacist if they were to have access to social care, if they were to have access to mental health services, if they were to have access to housing, then of course they wouldn't be coming to the GP. But unfortunately, they have nowhere to turn. The public is left in a limbo. Where do they go if they have a financial worry and they need a sick note and they can't work and they're stressed, or if there's a leak in their house and they've got damp in their house? Who do they turn to? It is their GP, and we've tried our level best to deal with every problem that pops up within the society. We try and be their friend, we try and answer any query, we try and facilitate them, and we certainly need to change this narrative. Your GP is your advocate. It was never GP versus the public or versus patient. The GP feels for you, the GP is worried about you, and the GP certainly wants to help you out. Let me tell you, Susanna, this is not part of the contract. Doing you letters of support for housing, helping you out with your financial worries, these things can easily go to a social prescriber, but the way the system is designed is so inefficient that everything comes down to your GP, and your GP does try and help.
You are carrying the load, Anita. We could see that. Thank you to you and your colleagues for all the hard work. It's 7:38, so you've got 20-odd minutes before it all kicks off big time in your surgery and your patients come in, but I know that they will hugely appreciate it when they do get to see you. And the lovely moment in our film where you got a hug off your son, I can imagine how important that hug is for you every day when you come in after a busy day. Thank you for joining us this morning and all you're doing.